Okay, so imagine your heart is out here doing its job, beating nonstop. No PTO, no lunch breaks, just steady, loyal work. And then one day, a blood clot just shows up like, yeah, I'm blocking this artery now. No warning, no permission, just full on chaos. That's a myocardial infarction, a heart attack. It's your heart muscle literally dying because it can't get oxygen. And honestly, she's got every right to be pissed. Let's break it down. Myo means muscle, cardio means heart, and infarction means tissue death. So when someone says they had an MI, they're saying part of their heart muscle flat out died because blood flow got cut off. And it's usually thanks to a plaque. Yeah, all that cholesterol and gunk that builds up in your arteries over time like drama in a group chat. One day, that plaque cracks open, a clot forms, and suddenly blood can't get through. And if the blood can't get through, oxygen can't either. And if the heart muscle doesn't get oxygen, boom, damage, permanent damage. Now, what does a heart attack actually look like? Let's talk symptoms, because this is where the test and real life try to play you. First, the classic, crushing chest pain. Tight, heavy pressure like an elephant is posted up on your chest. It might radiate to the jaw, neck, back, or left arm. They could be short of breath, sweating, nauseated, dizzy, pale. It's giving full body panic. And in women, older adults, and people with diabetes, it can show up without chest pain at all. We're talking fatigue, GI symptoms, weakness, or even just confusion. That's called a silent MI. And NCLEX loves to throw that curveball. Now, when someone rolls into the ER, we got to move fast. First, we grab a 12-lead ECG to see if there's any ST elevation. If there is, we're dealing with a STEMI. That's the big one. Then we check troponin levels. This is the lab that tells us if the heart muscle is damaged. If troponin's elevated, we've got trouble. Now let's talk treatment, and let's clear this up right now. You've probably heard of MONA, morphine, oxygen, nitroglycerin, aspirin. That's cute, but it's not the order we give things. The real order is ONOM. First is oxygen, but only if their O2 saturation is below 90%. Then nitroglycerin to help open those blood vessels up and reduce the workload on the heart. Then aspirin, chewed, because it helps stop that clot from getting bigger. And morphine is the last option for pain if nitro didn't do the trick. So remember, MONA is just a memory trick. The actual order is ONOM. Now we move into intervention mode. If it's a STEMI, the goal is to get that artery opened up ASAP, ideally within 90 minutes. That means cardiac cath lab for a PCI, percutaneous coronary intervention. They thread a catheter through the artery, bust the clot, maybe place a stent, and restore blood flow. If they can't get to a cath lab fast enough, they might use thrombolytics like alteplase to bust the clot with meds. That's only for certain patients and within a 6-hour window from when symptoms started. After that, we're starting long-term meds to support the heart and prevent another attack. Beta blockers to slow the heart rate and decrease oxygen demand. ACE inhibitors to lower blood pressure and help remodel the heart. Statins to lower cholesterol. Antiplatelets like clopidogrel to prevent new clots. This isn't a one-and-done situation. The follow-up is just as important. Nursing priorities. Monitor their vitals like a hawk. Watch the telemetry. This is the time arrhythmias love to pop up. VTAC, VFib, PVCs, you name it. Watch for complications like heart failure, cardiogenic shock, or another MI. And if that pain returns, we're treating it like a brand new problem. Patient education is huge. Take your meds every day, even if you feel fine. Start cardiac rehab. No more smoking, no more skipping appointments. And please, for the love of your own heart, don't ignore chest pain and don't rely on Google next time. Call 911. So, yeah, myocardial infarction is not the time to be playing tough. That's your heart waving a red flag and begging for help. Know the signs, know the treatment, know how to save a life, including your own. Follow Code Bluebait for more nursing content that actually makes sense, makes you laugh, and helps you pass the test. Wait, where's the part about the chest pain? Did I say the elephant yet? Did the elephant even sign the waiver? Okay, myocardial infraction? Why does this sound illegal? Can we just give them an aspirin and a prayer? No? Oh, okay. Time is tissue, but apparently my brain is too. Anyway, follow Code Bluebait before I get written up by my own animation.